All right, hello everyone. Welcome back for our next video. On this video, we're going to be talking about specifically something called SIBO. I mentioned the word SIBO in my last video regarding small intestinal issues that can come up. So let's go into more depth on that topic. Now, SIBO is a topic I've been wanting to talk about for quite a while because we've had quite a few patients come in misdiagnosed as IBS because the symptoms can be very similar or oftentimes can overlap IBS with SIBO. And SIBO often gets missed by GI specialists. There's still a lot of controversy whether it truly exists in their eyes. I don't know why, because there's a lot of research coming out regarding SIBO and its treatment and its diagnosis. But I'm going to explain a little bit more about why it's so confusing, difficult to diagnose, and oftentimes gets missed. And the cases that do get diagnosed, unfortunately, usually don't have a very good outcome or don't get treated appropriately. And we're going to talk about why that is. All right, so you can see here, this is all the things we've talked about in the past in the previous videos. You can go back and watch those videos for more detailed information on those. Let's talk about SIBO though. So again, like I mentioned before, SIBO stands for small intestinal bacterial overgrowth. And it's called that because what happens is bacteria, normal bacteria that's found in the large intestine, ends up relocating or translocating into the small intestine where it's not supposed to be. And that causes all kinds of problems. And if you look here, some of the most common signs and symptoms, let me move my face over here. Some of the most common signs and symptoms people experience are chronic bloating, and this is specifically bloating either after meals or bloating that worsens as the day goes on. Many times these people will say they wake up and their bloating is very minimal. And then once their day starts and they start having regular meals or snacks, their bloating slowly gets worse and worse and worse. And it's usually the worst by the end of the day. And it's almost always 100% in the lower abdomen, right? So around the belly button and below. I actually had a patient come in who gave me this really useful tip that said you can Google SIBO belly to look at pictures, and almost always they look the same. It's lower abdominal bloating, almost like you have a little food baby in there, but it's not normal, and it gets better early the next morning and then worse as the day goes on after meals. And especially meals that are high in carbohydrates, that are high in starchy foods, or high in fiber-rich foods, right? Now, this causes a lot of confusion and frustration in patients because oftentimes patients will try to eat healthy. They'll eat a lot of vegetables, a lot of grains or lentils, things that they consider healthy, but fiber actually makes SIBO worse. That fiber feeds that bacteria that's overgrowing in the small intestine, and it makes their symptoms considerably worse. Probiotics will also trigger that, and fermented foods will also trigger this and make this worse. So that's something to be very aware of. And oftentimes it's accompanied with either constipation or hardcore diarrhea, or a combination of the two, which also makes it very frustrating and difficult. The constipation diarrhea are caused by different types of bacteria that end up overgrowing in the small intestine. And so that's very, very important to be aware of because they respond differently to treatment. Okay. Now, how is SIBO diagnosed? Like I mentioned before, it's very difficult to diagnose. Most GI specialists don't believe it exists, or they don't understand the full spectrum of types of symptoms you could have. Oftentimes they say, well, you can only have diarrhea. So if you have constipation, then it's probably not SIBO, but that's not true at all. We've seen both, and it's documented in the literature that you can have one or the other. Colonoscopies, endoscopies, all those typical GI tests usually come back normal, Even a stool test done will come back normal because, again, the bacteria that's overgrowing in the small intestine is normal bacteria that is supposed to be in the colon. It's just in the wrong place. It's moved from the large intestine to the small intestine, and it's not supposed to be there. And it's causing all these problems. But on a stool test, oftentimes it'll show normal. Okay, so again, that's why it's so frustrating and difficult to diagnose. Now, there's a test called the SIBO breath test. Unfortunately, most major healthcare facilities have stopped offering this test. I had a patient go to her primary care doctor in Kaiser and ask for this test specifically because I know they were doing it at one time, and they told her that they're not offering the test anymore, that it's only being offered for research purposes, and that it has no value to them there, which is unfortunate because it can give us quite a bit of information regarding the type of bacteria you might have overgrowing and if it's triggering the constipation or the diarrhea. Okay. However, we have I personally have shied away from ordering that test for patients because, one, they basically make you eat a lot of sugar to force the bloating to worsen so that they can measure it on a test. And if someone is already suffering from chronic pain and symptoms and bloating and discomfort, and they do that test and it flares them up even worse, well, they're pretty upset about that. They're mad at me and they feel it may take them days to recover from doing that test. So usually we look at the previous symptoms I mentioned before. These are pretty unique to SIBO, right? The lower abdominal bloating that gets worse as the day goes on, intolerance to fiber, intolerance to probiotics. If I see that in a patient, if they tell me that, I'm thinking right away, likely SIBO, okay? And so I treat it as such. Now, the causes of SIBO is another reason why it's so difficult to address appropriately. SIBO is not just a small intestine issue, okay? This is a little diagram I drew for you guys showing you all the possible causes and contributing factors of SIBO. We have chronic anxiety, okay? Because chronic anxiety increases stress. When you increase your stress, you decrease the function of your digestive tract, which then impedes digestion and proper movement or motility of food through the intestines. Okay? Chronic stress does the exact same thing. Lack of exercise. Now, lack of exercise specifically is great because, one, you're forcing movement through the abdomen and through the intestines. But exercise also is extremely healthy for the brain. It feeds the brain, which in turn feeds into the digestive tract. I'm going to talk a little bit more about that in just a few minutes. Hypothyroidism. Okay, now I've made a lot of videos on hypothyroidism in the past. It's something we work with a lot in our office. But hypothyroid cases, if they're being mismanaged or someone doesn't know they have it, will cause a decrease in digestive function, 100%. So both the thyroid and the digestive tract and the SIBO have to be addressed all at the same time to have best outcomes. If you only try to address the SIBO without looking at the other underlying root causes, people don't have good outcomes, or their SIBO goes away temporarily and then comes back a couple months later. Okay. H. pylori infections. If you remember from one of our first videos, we talked about hydrochloric acid production in the stomach for proper digestion. H. pylori is a bacterial infection that stops the production of hydrochloric acid. That in turn shuts down your digestive tract and can lead to SIBO. Food poisoning. If you get severe food poisoning, which causes you to get really, really sick, with severe vomiting and severe retching of the stomach, that can cause that movement or translocation of bacteria from the colon to the small intestine. And then concussions or traumatic brain injuries. And I'm going to expand on that in a second here, right? So again, if there's a history of concussion or traumatic brain injuries, or even a whiplash incident, most commonly experienced in a car accident, they may have underlying post-concussion syndrome symptoms that have been there for years that are slowly contributing to the SIBO. Okay. Now, let's talk a little, without getting too much in depth, I want to describe here how the brain and the digestive tract influence each other. I'm sure people have heard of the brain-gut axis, and this is super important in the area of SIBO and treating of SIBO. The reason this is so important is because the lower brain stem, this green dot right here, the lower brain stem, oops, is responsible for what's called our parasympathetic activation of our nervous system, which means our activation of our digestive tract and relaxation, okay? Contrary to that is high stress, high anxiety, right? So when stress is up, anxiety is up, digestive function goes down, and vice versa. When we're relaxed and calm, digestive function goes up, and stress parts of the brain go down. So this lower part of the brainstem feeds out and encourages healthy function of the digestive tract and proper movement or motility through the intestines of food. And in turn, a healthy digestive tract then feeds back up into the brain and encourages a healthy brain. So you can see how a concussion or a brain injury can cause breaking of this connection down to the digestive tract, and vice versa, a bacterial overgrowth issue in the digestive tract can cause breakdown of this feed forward mechanism to the brain. So it becomes this vicious cycle of, well, the brain is not working appropriately, now the digestive tract is not working appropriately, and we have to address both, because if we only address one, the other continues broken, and so we do both, okay? This is a big piece that's missed in most SIBO programs or SIBO treatments, okay? So how do we treat it? Well, the conventional medical model, if you're lucky enough to get diagnosed, they rely on antibiotic, usually just one or two different types of antibiotics specifically used for SIBO. However, like I mentioned before, if the pre-existing conditions or the root causes here are not evaluated and addressed, you have limited improvements or limited outcomes. On top of that, the antibiotics that exist oftentimes work best only for the diarrhea type of SIBO, not the constipation type of SIBO, unfortunately. They're starting to find that out more and more in the research. And so if you're stuck with the constipation type of SIBO, you may not have any improvements with the antibiotics that exist. And the last piece is the antibiotic, depending on your insurance coverage. We had a patient who got a quote for the medication. It was going to cost her $1,300 for one course of the antibiotics. If she had to do another course, it would have costed her another $1,300 on top of that. And sometimes people do have to do multiple courses to try to get some relief. But again, the root causes usually aren't being assessed and addressed, okay? So the way we look at this is we go through multiple steps and phases. We use plant-based antibiotics, which we call antimicrobials, okay, that work very well and are less harsh, but they do take longer to work. Usually we put people on a 6 to 12 week program of a combination of these different things. So we start them on antimicrobials. That's to help kill off the bacterial overgrowth in the small intestines. We put them on a low FODMAP diet, which eliminates a lot of that fiber and starchy foods to inhibit the growth of that bacteria. So we can starve it out while we're doing the antimicrobials, and we're doing brain-based neurological reintegration of the gut. If we find that that is a big issue, there's a lot of things we do in the office to reintegrate. Exercise is something that can be done on your own to help reinforce that connection. Remember, exercise helps to have a healthy brain. Healthy brain then feeds forward into the digestive tract, which feeds back into the brain. So exercise is a big one. Other neurological reintegration, you could do visceral massage, so hands-on massage to the abdomen and to the intestines. Massage, percussion type therapies, and there are multiple brain-based therapies that we use in the office to also reintegrate this system. If stress is a big factor contributing to your SIBO, We have to implement stress reduction techniques. And then, like I said, this program can last anywhere from 6 to 12 weeks. And then towards the end, we slowly start to reintegrate fiber and probiotics because it is important to have diversity of food in your diet, especially different fiber and vegetables. They do feed the good bacteria, so we can't keep you on a low FODMAP diet forever. So we slowly start to reintegrate those fibers, foods, and probiotics and prebiotics. And by that time, you should be able to tolerate them more and more, which means we slowly increase the amount you eat over time, eventually getting you to as normal of a diet as we can with experiencing minimal symptoms. All right. Thank you. I hope you enjoyed that. It was a bit long, but very necessary. Stay tuned for our next video. Thanks.